Now, let's bring in a couple of people who are sitting it out in a lockdown on either ends of the country at the moment. Gemma Tognini, Sky News contributor and founder and CEO of GT Media, joins us from Perth, already in lockdown, and the former Premier of Queensland, Campbell Newman, joins us from Brisbane. You're not quite in lockdown. You've got about half an hour to go to Campbell. Do you believe this is completely unnecessary and counterproductive?
Oh, look, I think there's a necessity for, the sort of measures you were talking about before, social distancing and the like, and the wearing of masks. But the 3-day lockdown says this, Chris. It says that the Queensland government's incompetence and Queensland Health's incompetence has allowed this to suddenly rear its head, and they're worried about it. I can't believe that we had the Premier on Sunday night waving through an event being State of Origin with 52,000 people in Suncorp Stadium and saying it was okay, but 12 hours later talking about urgency, putting up the fear factor, going on about it at length and saying we have to act now and imminent, and then back into restrictions and the like. So there's a very cynical exercise going on as well with this, Chris.
Yeah, it's amazing that she's gone from that to that overnight. I mean, it's evident of the madness, of the lack of rational processes we're seeing in this country. Gemma, you've been through lockdown before. You've heard Clay College and other medical experts say that the other lockdowns were superfluous. They added nothing to the fights against those clusters. Yet here you are again, and there's no extra cases today.
None. And the three yesterday were linked, is my understanding as well. So there's no mystery case sort of circulating around Western Australia. Oh, yeah. The thought occurred to me last night, Chris, is, I wonder if it's like, lockdown for association's sake. I mean, it is absolutely an indictment on the WA health system, and it's well publicised here, the strife that the WA health system is in. Just 48 hours ago, the number of ambulance ramping hours here reached 5,000 for the first time in history. That's incredible, and not in a good way. A damning indictment on WA Health and the Health Minister, Roger Cook, who has been under tremendous pressure for the last several months over his handling of that portfolio. And all of a sudden, here we are in lockdown. Look, it is not sustainable. There have been incredible scenes of people flocking to the Claremont Showgrounds here, which is the major metropolitan vaccine hub. And we've not seen numbers like that before. Perhaps a dose of reality. Certainly the reaction to lockdown here in Western Australia this time has not been Premier McGowan will do everything you say, you're doing everything brilliantly. It's been far more, there has been far more pushback on talkback radio and in the newspapers, because this is unsustainable. This is not how it's supposed to be. As you pointed out, the rest of the world is moving on, moving through. And this lie, because it is a lie, I mean, the hubris of any politician to suggest that they can make beat a virus or eradicate a virus. Like, tell that to science and bang on about believing the science. Well, have a chat to science about how easy it is to eradicate a virus. It's a lie, it's deceptive, and it's so dishonest when speaking to a population who they should be trying to take along with them on this journey.
Yeah, Campbell Newman, I think this is a problem because not only are the lockdowns heartless, not only do they create all sorts of additional problems for people, for communities, for the economy, but of course this zero COVID mission that all of our state governments are now on, that encourages people not to get a vaccine because they figure that we can just keep this virus out of our country forever. That's entirely the wrong message to be giving them.
It has been indeed, Chris, and the zero COVID sort of mission is a fool's errand, as I think Gemma quite clearly just set out, and it is not going to be achieved. Really, the whole thing now should have been about the vaccine rollout, and I think like probably most Australians, we're sick of the finger pointing between federal and state to federal. We want them to get on with it, to step on the gas pedal. There have been so many mixed messages. We've got plenty of time. There's no burning platform. That spoke volumes when federal health officials said that months ago. But while I'm on the subject of officials, I mean, on the one hand, the Premier again's talking about urgency. It's a crisis. It's terrible. Well, the breaking thing today up here was that a Queensland Health employee at one of the hospitals who wasn't in a COVID ward, who was working nearby, has contracted the virus, it's believed to be the Delta variant, has then gone for 10 days perambulating through northern Queensland, hence the Townsville lockdown. Why wasn't this individual vaccinated? Why wasn't it taken more seriously? You know, we've got a Chief Health Officer just been nominated as the next governor who's responsible surely to inculcate a sense of urgency, to make sure the right practices are there for health professionals, and this has gone on in a hospital, and so the state's really been locked down because of that. But try this, Chris, just the icing on the cake then. If there's a sense of urgency, you'd think there'd be a sense of urgency in getting a vaccination. So this is fresh off the Queensland Health website this afternoon. So these are Metro South Health vaccination facilities in Queensland, in Brisbane. Princess Alexandra Hospital, well, they're open Monday to Friday, 8 till 4, so you can get your shot. The QE2, really working hard there, 8 till 2:30, and I could go on. Why aren't they working 18 hours a day, 7 days a week? Why not even 24 hours a day? The Premier amped it up in the last sort of 24 to 48 hours, saying it was a crisis, saying there was urgency, saying we needed action, saying she needed to just nip things in the bud. Well, this is what's really going on. Ineptitude, incompetence, and complete complacency within the health system.
I've got to say, that's the thing. As long as you've got enough vaccine, you just got to get it out there. Pfizer, AstraZeneca, make it available to people. You can get it from your doctor, get it whenever you like. I mean, I haven't got vaccinated yet because the only time Chris, I could get it was lunchtime, and I'm busy, Chris, I'm booked in for a couple of days.
But Chris, what do you expect from a Premier and a Chief Health Officer who didn't get the shot? They spent weeks,
but as the point is,
people to get the shot, and the hypocrisy, both of them didn't get the shot.
Sure is, but the problem is right around the country, state and federal have conspired to muck this up. The last brief word on this, Gemma, is other people suffering in hospitals because elective surgery is delayed by all these overreactions.
It's not just elective surgery, it's the fundamental damage that these lockdowns do, that it is undisputable, Chris. It is inalienable. It's been proven the world over for the last 18 months. The Queensland researchers in the last week released a piece of research that talked about the shadow pandemic in domestic violence, not just in the number of attacks, but the veracity of attacks. We all know about the mental health toll. We know about the economic Chernobyl that's been visited upon Victoria. Lockdowns are damaging. They damage the most vulnerable in our community. From a policy perspective, they are lazy, and
Absolutely.
I cannot believe that 18 months on into this pandemic, they are still being used as a substitute for sophisticated, mature, rational, clear-headed risk management.
It is outrageous. I thank you, Gemma Tognini and Campbell Newman, and I wish you luck in your latest lockdowns, and I just hope I don't join you soon. There'll be one infection in South Australia and we'll be joining you. I'll tell you what, that's the way these people roll.